Hi everybody, my name's Jonathan Schofield. I'm the Deputy Director of CASCADE, which is the organisation that runs ExChange, which is this outfit that's organising the seminar today. So we've got Dr. Emily Lowthian, and Emily's a lecturer in education in the Department of Education and Childhood Studies in Swansea University. So she largely conducts quantitative research to understand complex inequalities experienced by children and young people using existing national records or other data sources. And it's one of those studies that she's going to tell us about today, with a particular emphasis on really drilling down into the experience of looked after children in terms of their education and looking at different kinds of circumstances of being looked after. And she'll tell you more as we go on. So I'm going to shut up now and put my camera off. Emily's going to speak for about 40 minutes. If you have questions as you go along, we'll save the questions until after she's spoken, but please do write questions in the chat. Also then when we come to the end, people can put their hands up to ask questions. But if you've got something that a burning thought as you go along, just put it in the chat and we'll try and come back to it at the end and ask Emily to comment on your thoughts. Okay, so thanks for coming along, Emily. I'm going to keep quiet now and hand over to you.
Okay, thanks so much, Jonathan, for a lovely introduction. So hi everyone, as Jonathan mentioned, I'm Dr. Emily Lowthian. I'm a lecturer in education in Swansea University, and I've been doing a funded project by Health and Care Research Wales, and this funding kind of came in January 2022, so it was quite a while ago. I think it was January 22, or maybe 23, not 22. Sorry. The time goes so quickly, it's hard to keep up. But yeah, it's largely the project's looking at the educational pathways and outcomes of care experienced children. And this is a population scale data linkage study. And what I mean by that is basically we're using records that are already held by social services, educational providers, local authorities to analyse that existing data and to use it for kind of public good and research purposes. I just want to quickly acknowledge that although I was PI for this study, this was very much a collaborative effort among Cardiff and Bristol, as well as Swansea, with people who kind of really helped me develop the data, set up the data, make decisions on analysis, dissemination, how to kind of put across the key messages, because there are lots of messages in this work that I would love to get across. But as I said, I've only got 40 minutes. So yeah, without kind of egging it on too much, I just want to really make sure that everybody in this project is appreciated, just because I'm delivering it today, but that doesn't mean that's just me. So in terms of kind of what I'm going to go over today, I'm going to talk about kind of what the evidence currently tells us about care experienced children's experience of education, what the knowledge gaps are in the research area and how we address them, our research aims, how we analyse data in the SAIL data bank, how we worked with care experienced young people and stakeholders to inform our project. So obviously we have a great research team with us as well, but we also had an advisory group and various publication involvement. I'm going to talk about the findings of the research, which hopefully is the most important part, maybe, and some implications. So just some things to be aware of with our study. So just to kind of talk about the team a little bit, what's really nice is that over the time since I've started this, quite a few people have become professors. So it's just a small congratulations to those who kind of have progressed alongside this project. So it's with me as PI, Tom as co-PI, Stu has helped a lot in terms of the statistics and the kind of data management and preparation side of things, which no small feat. I've had Donna Forrester within Cascade and Lucy being kind of guidance aspects on this project, particularly around the notions of what children in care and what that means. Alex has been instrumental for boosting our sample. I'll talk about that a little bit later. Ashley in terms of SAIL management and data preparation, and John and Gemma joined our project a little bit later on, just because they came from Bristol and helped me a lot with some very complex analyses, which are, I would argue, probably cutting edge analyses in this space, which haven't been done before. So to talk about kind of, first of all, I suppose the setting and the field of educational outcomes for care experienced children. A systematic review essentially that we read in the beginning confirmed that care experienced children have lower educational attainment overall compared to children who have no social care intervention. Now, obviously, that doesn't account for all children. Some children will progress and reach their potential, regardless of their experiences. This is just a general trend overall that care experienced children do have lower educational attainment and generally a poorer experience of school. So whether that's kind of behavioural outcomes or enjoyment of school or feeling belonging or moving around schools a lot, they generally do have a poorer experience of school. And to give some kind of numbers on that, 50% of care experienced children reach the expected standard in reading compared to 74% who have no intervention at all. And this compares again to 46% in maths for children who are care experienced compared to 76% of those with no intervention. So we can see quite stark differences for those who are care experienced versus non-care experienced, even as early as age 7. So they've only been in school for about 3 years. And that gap widens to 40 to 70% in age 11. And by the end of secondary school, we can see quite a significant gap widening from 17% achieving the GCSEs expected, so 5A star to C, compared to 60% with no intervention. So there are quite some stark kind of findings in educational outcomes, and we really wanted to get to the bottom of why this happens. The idea is that we can hopefully create some kind of solution-orientated suggestions for policymakers, schools and stakeholders, etc. In terms of kind of the protective factors and risk factors that exist for children, those in the research areas that longer, more stable placements tend to benefit care experienced children for their educational potential and attainment. Those who entered earlier into care tended to do better in attainment as well. And those who attended schools which focused kind of specifically on supporting disadvantaged children. Sorry. So there are some really clear research that actually suggests some really kind of protective factors for children and things that can really support them. But on the other hand, there are some key risk factors, so instability, so moving, lots of placements or really short periods in care and then returning home seems to be a specific risk factor for children. Being excluded or suspended, much like those with no intervention, has a negative impact on attainment. And those who have autism or previously was kind of defined as autistic spectrum disorder in that research. So these are the sorts of main protective risk factors, and that's kind of what we built our study on, was this existing knowledge that we had. So there does seem to be an evidence gap. We needed to know a little bit more about the cutoff, so in terms of short-term versus long-term. So the way research kind of works is that it cuts it off into like less than 1 year or less than 6 months versus kind of stability for 2 years or maybe a bit longer. But this is really arbitrary, and it's quite hard actually to define what is short-term versus what is long-term. And it's quite kind of the answers we get are kind of to an extent driven by how we cut things up in the data. So we wanted to think about how could we do this in a more data-driven way. So what does the data tell us about what's actually long-term versus short-term, rather than making our own definitions. We also wanted to understand the contribution of multiple placement types, because this is a key evidence gap. So a lot of the research will compare foster care to kinship care, or those who have been in multiple placements versus those, with other parents or those who are adopted. But actually, as many kind of social care associates told us, lots of children have very different experiences of care and move through care quite differently. And we wanted to kind of capture that as much as we could. And then we also wanted to combine all aspects of care to establish a relationship with educational attainment. So children's care histories are really complex. They're in care for kind of short periods, long periods, they have different placements, and they also come into care at different ages. And that really matters for kind of developmental windows and kind of the point of, I suppose, removal or family breakdown or family issues really do matter in terms of attainment and what attainment can kind of, what house schooling can be supported, I suppose. So that kind of leads us to our main research aims, which I'll talk about in a moment. But we also wanted to understand how characteristics are associated with different care movements. So were girls or boys more likely to be in different kind of care movements or have different care histories? Were there differences for children of different ethnic groups? Were there differences for different mothers' age or deprivation? Because this is kind of less known in terms of more complex histories, but it is known in terms of general kind of specific just placement types. And our last gap is the kind of identifying what works. So I talked a little bit already about risk factors and protective factors. And obviously there are a lot more factors that could kind of predict educational attainment for care experienced children, or at least help explain why that's happening. And we wanted to, using our data, try and find as many potential protective or risk factors as we could to kind of guide and understand outcomes for children. So in terms of our objectives, and these seem quite text heavy, so I will try and simplify them, but I talked a lot about care histories. And what we wanted to know with care histories is if we use a kind of data-driven method, so we put all of the data in and we say, what groups are there that have similar histories? We asked the data to do that. So we said, here are all the different placements there are, here is the age of entry, children go in, and here is their duration of care. What groups exist for those in the early years, so from birth to age 6 to 7, follow them over that time period and tell us what common groups there are that have similar histories. And then we did the same for pre-adolescent, so those from birth all the way to 10 years, 10 to 11, again, put the same data in and say what groups exist. If we put all of that data in, they're common groups for early years and pre-adolescent groups. I'll talk a bit about the sample in a moment, but we wanted to use then these groups of early years and then adolescent groups to look at Key Stage 1 outcomes and Key Stage 2. So this will be outcomes taken at year 2 and also then at year 6. And these will be your standardised assessment, because this sample is before the foundation phase. And our last objective is this risk and protective factors for GCSE attainment following care movements, using data on individual and school-related factors, essentially as much as we could. So to talk a little bit about our project and how we informed this project, we used multiple different aspects of public patient involvement, but essentially kind of different voices and stakeholder involvement is really what I would prefer to call it. So Cascade Voices, a care experienced young persons group in Cascade, has been really instrumental for this work. We met with them twice over the course of this project. The initial was to discuss the initial research, you know, how should we define different placements, what aspects of placement should we use, how important do you think they are, and then we looked at kind of what elements of what work should we focus on, because we had lots of different aspects of what works in terms of like school deprivation or mental health. Then we asked them from their opinion which ones are the most important to focus on in terms of risk and protective factors. We also then before we even disseminating any of our project results, we took our results to Cascade Voices in March this year and went through our findings and asked them lots of questions about what their opinions were on this work and how important the work is and where they think our work would be best placed and kind of where our work should continue onwards. And I'll talk a little bit about that and throughout this, because I think it's important to embed it throughout rather than just to talk about it now and move on, because it does have an important meaning throughout the work. We also work with teachers from the Happen Network in the initial stages to talk about kind of their professional experience and understandings of working with care experienced children and what they thought about the project. And we also worked with an advisory group comprising our social care associates, government officials, charities, and other academics to feed back on our initial objectives of our work, but also then we did recently, at the start of last month, did a presentation, maybe in the end of last month, but we did a presentation on our findings and gathered some feedback, and we embedded that feedback into this and also our final stakeholder and lay summary report. In the beginning of the project, we worked the SAIL consumer panel to get their initial kind of opinions and perspectives on the use of the data, whether they thought it was for public good, and their initial opinions on our project. So throughout this entire project, we've tried to embed as many different voices and as many different perspectives as possible, because we're aware this is really important. So in terms of how we did the actual data side of things, so how did we get the data? We used SAIL. So maybe some people are already familiar with SAIL, but if not, it's essentially a data bank which holds all of the different kind of national records, so education, health, social care intervention, demographic information. It's all anonymized, so we can't work out who it is, which is a really important aspect of this. They're just for kind of research good, public good, to develop kind of research which hopefully informs practice and policy. And we built an electronic cohort of children. So essentially children who were born between September 2000 and August 2003. We followed them right up until the end of GCSE or Key Stage 4. So we followed them through their entire kind of compulsory education for what it was in their cohorts. And like I said, we followed them right until the end of secondary school, and we essentially derived their histories and outcomes. So Stu spent a lot of time working out kind of how many placements they'd had, what age they came in, did they go back in, did they kind of what was the age they came into care, and what aspects did they experience in secondary school, and what were their outcomes. So we used all of this data to derive that. So there are essentially three academic cohorts of children in this work. And then we linked their data in terms of birth data, demographics, social care, health and educational records all together. And I want to kind of touch on to the technical aspects of this work that was really important. So part of the initial issues we had with the social care data was that we didn't have that many children that we could link to kind of educational records. And obviously the smaller the sample you have, the harder it is to do analysis, particularly quantitative analysis, which relies on big, to an extent, big numbers. So yeah, Alex and Grace developed a boosting kind of algorithm which Stu used in our work. And you can see that the green in the graph on the right was the original numbers we had, so the original percentage that we were able to link. And actually the blue is then how, when boosted, that was how many more children we had. And this work is soon to be published and is something that will be embedded in SAIL for researchers to come. But I just kind of wanted to put a spotlight on their work because it was instrumental for this work actually to be able to happen, and has really accelerated kind of data availability and field. So with this cohort of children, so around about 1,000 children in total, we looked at different ways of defining care experience. So care experience, we had binary flags for placement types and reasons that their care ceased, whether they were adopted or whether they returned home. We looked at foster, kinship and parental care, and also adoption. We looked at the age they first entered care and their duration of care. And that's the data we put into the machine to say what group, when we considered these variables or these aspects of children's care histories, what common groups come out. We also adjusted a lot of our analyses for sex, ethnic group, deprivation index, learning difficulties where possible, but there were issues adjusting for this, birth characteristics and mother's age at birth. And like I said, our educational outcomes comprise of Key Stage 1, Key Stage 2, and Key Stage 4, essentially age 7, age 11, and age 16. In terms of our analysis, I won't say too much about this because I'm to an extent probably repeating myself. But like I said, we followed early years care movements in Key Stage 1. So we followed children basically towards the end of year 2 and classified groups of children with similar care movements and linked that to their educational attainment. We then did the same thing for the same sample, but followed them up to age 10 and looked at their care histories towards age 10, and then looked at their Key Stage 2 outcomes. And then our final kind of what works for educational attainment analysis looked at the different groups that were identified all the way up to age 10, and looked at how those care movements between birth to age 10 affected GCSE attainment. But we wanted to understand if there were specific aspects which could explain that relationship between moving through care and then educational attainment. And we focused on special educational needs, so that they'd ever had any diagnosis of special educational needs or identification, school attendance and moving through school, preschool meals, mental health, and suspensions and or exclusions. And from what I'm aware of, preschool meals now seem to be available for most care experienced children, but at the time that this research was done, I believe that it was prior to that. So if children had preschool meals, it was likely because they were kind of flagged for financial support requirements and were kind of given those. So slightly different, and having to remember that this was a cohort followed from 2000 to kind of 2018 roughly. So yeah, just bear that in mind. Okay. I'm going to talk a little bit about the results, and I hope things are clear-ish, but if not, I will reiterate them as I go through. So focusing on our early years care movements and attainment, when we said to the data, here are all the aspects on the children's care histories, and can you tell us some common groups? We had 7 common groups, but I kind of simplify them here. So our first group was 2 groups of foster care. We had some children who had long-term foster care and came in just preschool, right before coming into school, so just around age 4 or slightly before age 4. And then those who came into foster care just after school had started around age 5. We also had those who were adopted. That was a small proportion of our data, but there were some children who were adopted. We had a specific group of children who returned home after a very short period in care quite early on in their lives. We had two groups of children who had very mixed placement, so a mix of kinship care, parental care, and also foster care. We had a group that came in just before their first year of life. We also had a group of children who came in around 2 years old. And then we had our group of kinship care children who largely had kinship care throughout the early years of their lives. And as we can see on the graph on the right, adopted children tended to do the kind of highest proportion of educational attainment, with 100% reaching Key Stage 1. I will note that this is what we call a masked estimate, so I can't give you the true estimate just because of how small the sample is and how it potentially could identify some children. We want to obviously completely avoid that. So essentially, we can say that adopted children met nationally expected levels for Key Stage 1 or at age 7. Our second group are those with large kinship care, so 66% of them on average met that kind of Key Stage 1 element. Those who were reunited with family, so those who came into care quite quickly and then went home, 63% of them met Key Stage 1 outcomes. And for those who had quite mixed placement, so just before 1 year old or coming into care kind of around 2, 58 to 65% of those met Key Stage 1 outcomes. And then for our foster care group, it really depended. So for those who came into care just before school started or in the initial stages of school, only 40% of them met Key Stage 1. Whereas for those of them who came into care just after school had started, so around kind of age 5 and a half, 63 of them met the expected level for Key Stage 2. So what we could see in these, and a similar pattern is observed for our mixed placement groups as well. So what we can see here is that timing really does matter when it comes to education from our results. And I want to kind of reiterate that the general population, or the population with kind of less likely to have care intervention, is around 80%. So we can see that all of our care experience groups, except adoption, were actually not meeting the kind of expected requirement, or were in line with the general population level of education outcomes, but timing seemed to matter here for the early years. Now, if I talk about our other groups, so we have the early years, then we, like I said, we also followed children all the way their entire care history up to kind of age 10, 11. And then we looked at this in relation to Key Stage 2. So it's the same sample, but we just followed them for longer to look at longer care histories and to relate that to kind of their final primary school outcome and what they finished with. So again, we had 7 groups, but the 7 groups looked slightly different because obviously we're following their care histories for longer. So our first group was foster care. They came in at age 6, largely just had foster care themselves and stayed in foster care for a little while. We also had a group that were adopted, but we are now starting to get in those who were adopted a little bit later. So not just those who were kind of adopted in the early years, but also those who were adopted a little bit later in life. And this matters, and I'll talk about that in a moment. We also had a group who returned home, but there were 2 groups who came into care briefly and returned home. And this matters because there were some children who came into care really early, so around kind of age 2 and left and went home. But there were also some children who came into care around age 8 and then also had a relatively high likelihood of returning home. And there are quite big differences in how these groups performed in education. We also had a group of mixed placements. So there were some children who came in at age 1 early, and then some children who came in just before school at age 3. Again, these groups were groups that likely had parental care, kinship care, and foster care, and experienced all of those. We can't for definite say the order in which they experienced these, but we can say that they had likely would have had all of these, or at least 2 of these placements. And then we had a group of kinship care similarly to our previous kind of analysis. But kind of, again, if you look at the attainment graph on the right, we can see for those who were adopted, now only 60% on average met Key Stage 2. Now, again, to benchmark, the general population of Key Stage 2 is around 80%. So we can see that we're now starting to observe a kind of gap in adoption of 20 percentage points. So it, on average, is lower than our general population group. We're starting to see kind of other patterns emerge. So I'm going to talk about the reunited with family, which is the bottom group. The reunited family, for those who went into care early and came out and were replaced back with their birth parents, 52% of them met Key Stage 2. Now, this is really important because for those who came into care later and then returned to their parents quite quickly, so came in at age 8, they actually did poorer in education and were our lowest educationally attaining group at 36%. So for those who come into care early and then for those who come into care quickly and then return home quickly, timing did seem to really matter in terms of educational attainment at Key Stage 2. Timing mattered in our last one, but we can start to see quite large differences here compared to other groups. In terms of the rest, for kinship care, foster care, and mixed placements, a lot of these groups were quite similar in educational outcomes. So for kinship care, 45% of them met Key Stage 2 attainment. For foster care, this was 43%. And for those with mixed placements, we could see a 6 percentage point gap between those who came in early at age 1 and for those who came into just before kind of school started at age 3. So generally speaking, we can see some kind of similarities in Key Stage 2 and the disparities that we observed in early years have started to reduce here from what our data tells us. And we can obviously see that adopted children are now not starting to kind of reach the expectations as if we thought they would. In terms of other key findings, girls, generally speaking, had increased odds of attainment. This is in line with general population data. Those with low birth rates reduced their odds of Key Stage 1 by 17%. Again, kind of similar to general population statistics, but this sample of children is at different risk and has different challenges. So it is important to consider that what low birth weight means for care experienced children compared to general population children. Children in foster care were less likely to be born into affluence. Again, something important to consider when it comes to educational attainment. We also found that children of ethnic groups who were Black, Asian, mixed, and other ethnic groups had a 21% increased odds of Key Stage 2. So the research in general population is very dependent on ethnic group. Ideally, we would have loved to have broken these down and to look at specific ethnic groups and how it relates to educational attainment. We weren't able to do that because the number of kind of minority ethnic children in care was actually quite small. I think it comprised about 7% of our sample. And then we had adopted children were more likely to be born into affluent settings. So some of these things probably are kind of expected in line with other kind of research. So we weren't too surprised by most of these findings. I want to move on now to our risk and protective factors for GCSEs for the last 10 minutes of this presentation. Just to give you a kind of diagram of how this works. So we, like I said, we track placements all the way from birth to age 10/11. We look at how they perform in GCSEs. What we're really interested in is, could risk and protective factors explain the relationship between care placements experienced up to age 10 and GCSE attainment? So could there be things in place to support young people in schools or maybe in health that could support them with their educational attainment? So just to give you some kind of prevalence statistics, which I also think are quite helpful in thinking about what these children in this sample had experienced. 75% of the sample at one point had experienced SEN or ALN, which is incredibly high. Now, some work I've just done with Catherine Knight on SEN ALN, we found it is around 47%. So children from kind of who have care experience are overrepresented when it comes to special educational needs. 5% of them had a mental health problem or treatment or diagnosis or symptoms, and we do think there is possible under-identification in how we at the moment identify mental health problems for children in SAIL, and that's something to kind of consider later on. And this may be a specific problem for this sample, but generally speaking, general population is around 1 in 10. So we are a little bit concerned about the under-identification here. We also had 1 in 2 had free school meals, so half of our sample had free school meals at some point. 35% had experienced suspension or exclusion from school, which is considerably high compared to the general population, and 93% was the average attendance over the secondary school period, which is about in line with attendance now, if I'm right. But attendance now obviously has dropped in average since COVID, so that's something to bear in mind that this was pre-COVID, so some of the stuff that we consider now doesn't quite translate to them. And in terms of findings for what works, these were kind of our main findings. So school moves were specific risk for children who returned home after a short period in care. So school moves were associated with a 40% decrease in odds of attainment and were a specific risk for those children who come into care quite early, stay for a short while and return home to parents. We also found similarly for free school meals, they were a specific risk again for children who came into care early and returned home quickly after a short period in care. And we found that more affluent children at birth had 7% lower odds of having free school meals. So there's something about here around how deprivation perpetuates over childhood and adolescence. And lastly, our suspension and exclusion were a specific risk, again, for the same children who came into care briefly and then returned home quickly. And suspension and exclusion was related to a 70% reduction in odds of attainment. So all three factors of school moves, free school meals, and suspension/exclusion were really important for children who had come into care briefly, quite early on in their age and their kind of life experience, and then returned home quickly. In terms of other aspects, we didn't find any association for a group special educational needs, but there were an 87% decrease in odds of attainment if ever identified, which aligns with some of my other work for general population samples. We couldn't, unfortunately, run the analysis on mental health and school attendance because the models just wouldn't run, and it's likely related to issues in kind of numbers. Obviously, mental health prevalence was really low, and we're not quite sure why school attendance wouldn't run, but after quite a few iterations, we couldn't get that to run. So unfortunately, we don't have anything about that yet, but obviously more research we may well do. And just to give you an overarching idea of what our research looked like, 14% met GCSE expectations compared to the most recent statistic I was given of 45% with no social care intervention. So again, we can really see like quite a substantial gap between those who come into care and their GCSE outcomes compared to those with no social care intervention. So in terms of the last kind of 5 minutes, I'm just going to talk through kind of some of our results to reiterate what we found. So like I said, adopted children reached the national expectations for Key Stage 1. I don't think for most kind of people would be necessarily surprised that this tends to come up quite a lot in research, but there is emerging research talking about how transitionary phases can be quite difficult for adopted children, and that's something we talked about quite extensively in the advisory group. We also found that children's place of relatives had higher educational attainment at Key Stage 1, which may be related to less severe experiences or social support, buffering that impact. But we need more research here because we were unable to adjust for kind of pre-care experiences in the way that we would like to, just because our models won't stretch that far yet until better methods come across or we can get more data. Those entering foster care just before school had the lowest attainment, and this group also were the most deprived group. So there is a possibility that the combination with school timing and early deprivation is related to lower attainment for those who come into foster care just before school. Again, we couldn't look at kind of their pre-care experiences in terms of adversity, but that's some kind of initial findings we have. And those in short-term foster care had higher levels of attainment despite other research. So other research looks at kind of just length of care, so short-term versus long-term, finds that children in short-term care have poor educational outcomes. But actually our research where children come into care quite early actually do slightly better where they're placed compared to other groups of children. But this gets quite complex when you think about our what works analysis. So I'll talk about that a little bit later. In terms of pre-adolescence, so specifically Key Stage 2, end of primary school, adopted children started, you started to see this 20% points gap compared to Key Stage 1. And we are wondering whether that's the inclusion of children who were adopted later in childhood as a possible reason compared to being adopted earlier in childhood, and what that could potentially mean for explanations. We believe when it comes to adolescence, timing really matters. So for short-term foster care, earlier entry is associated with higher attainment, but later entry is lower. In terms of mixed placements and kinship care groups had similar attainment and levels with no clear patterning observed in our results. So there is kind of quite conflicting and mixed evidence on foster care versus kinship care in terms of later educational attainment. And that's something that I would really like to do a bit more research on to kind of understand the mechanisms or what's happening behind the differences between those with kinship care and foster care. And we generally see less disparity across our groups observed in Key Stage 2 attainment compared to Key Stage 1. So there's something about longer term kind of educational outcomes and what that means for children, whether they're getting the support and attention that they need over kind of the longer period of education. And this is particularly important when primary school, generally speaking, is quite supportive and quite involved with parents. And when you move to secondary school, there's less involvement and kind of more towards kind of children doing more independent work. And obviously that may kind of hinder care experienced children further if they're not receiving the care and support that they need. Now, in terms of risk factors, those entering care on a short-term basis early in life and returning to birth families were at higher risk of school moves, free school meals, and suspensions and exclusion. And the idea is that the way the analysis works is this tells us that these factors are important for educational attainment. So there's a complex interplay of higher attainment and poorer experiences. So these group of children were 52% on average likely to achieve Key Stage 2, so doing better than other groups in pre-adolescence. But then something's going on is that they're having quite a poor experience of school, where they're at risk for a lot of kind of movement or deprivation and suspension and exclusions. So there could be possible key intervention points for those children who actually return back to birth families. And it's something for schools to consider. And actually throughout our kind of patient public involvement feedback, young people really pointed out towards towards school moves and suspensions being really impactful for their educational attainment. And it's still quite unclear at the moment for other groups on what could be kind of a risk protective factor for them for their educational attainment. And we do need a lot more research in this area to identify supportive areas. So in terms of our reflections, our research obviously does have some weaknesses. So we relatively do have quite a small sample for these types of analyses. And generally speaking, we'd like a lot larger sample, but you're working with quite a rare subgroup of the population. So the analysis will always be small. One of our issues was that because of COVID-19, we couldn't follow further educational years of 1920, 2021, because that data is not at the moment in sale, and obviously that's teacher assessed. So it's quite difficult to accurately compare that. So at the moment, we do have this kind of gap in educational attainment or educational data that we can realistically use. So we are kind of at the moment stuck in that kind of pre-COVID experience without ever able to kind of extend beyond that at the moment. We also stress that our results are not causal. They're very specific to the population and that we focus on children in care in the early 2000s and over their life course. And this is probability based. So while we talk about kind of general proportions, they are on average. There's also no adjustment for prior experiences. So I can't adjust for things at the moment like abuse or neglect or living with a parent with a serious mental illness, despite how important these things likely are to educational attainment in addition to the care experience. And I just kind of want to stress here that we're very aware that our research can be considered as stigmatizing. So young people talked a lot about how our research focused again on the negatives and how the negative rhetoric of care experienced children's outcomes are continually kind of discussed and how it can be very stigmatizing and actually can paint this kind of, I suppose, rather depressing outlook. So our research is intended to kind of support young people and to identify areas for support and to tell this to schools and to policymakers to rethink about strategies used and to kind of quantify the impact of those strategies. But we really don't want to add to this continual narrative of this vulnerable group in a negative way, but to say like these are the kind of negative impacts that are happening and something needs to be done. So our research is intended to be used for positive change, but we're very aware that it can be considered as stigmatizing. So in terms of our conclusions, we want to challenge the notion that educational attainment can be derived from individual aspects of care. So comparing the types of placements or timing individually is not enough to understand educational outcomes. We also are very aware that children who return to birth parents after a short-term care stay are very high at risk of poor school experiences. And it's possible that this could be a hidden population to schools. And so if this entry is later in life, lower attainment is also observed as well. So there's something quite important for children who come into care briefly and then return home, and they do seem to need quite a lot of support and may not be identified by schools as children who have had kind of adverse experiences in life, because unless that care experience is identified within the secondary school period, it may not come through. So that's kind of a key aspect of our research. And we also kind of stress, probably like every other research project, more research is needed into pre-care experiences and complex histories in relation to attainment. And policymakers and schools should pay attention to the risk factors identified in this research and rethink whether the strategies employed, particularly in terms of behaviour management, are effective for children with care experience. Okay, So diolch o galon, thank you so much. If there are any questions, please let me know. I'm really happy to take. I can see there's 13 things in the chat, but I can't read the chat at the same time and speak because I'm not that multitasking. But I also do have a report that I would like to share. If you'd like to know more about this research, we have had a kind of lay summary report made just recently, and I'll be sharing the shared drive where you can access that report and save it. Unfortunately, at the moment, it is only in English, but Cymraeg will be available at a soon point, and I will just add it on to the drive so you can access that at another point as soon as that's available, hopefully in the next week. Diolch yn fawr.
Diolch yn fawr, Emily. That's great stuff. Thank you very much. Now I will field the questions for you. We have indeed had a few in the chat. So the first question is from Zhongjun Park, who says, thanks for such an inspiring talk. The research sounds so fascinating and makes important contributions, all very positive. If I understand your research correctly, can I just ask why you focused on care movements in early years and pre-adolescent years?
Yeah, of course. So what we wanted to do was to make sure that when we were looking at Key Stage 1, we didn't want to capture any care history after Key Stage 1 because it wouldn't make sense. We wanted to make sure that we had timing. So any care history that was experienced in the early years, so from birth to age 6 to 7, and then look at educational attainment. So to make sure that the care came before education, so we could accurately look at kind of the relationships. And then the same for Key Stage 2, we wanted to follow them all the way up until age 10-ish, and then look at Key Stage 2 to make sure care happened before the next educational period. I hope that answers the question.
Thanks, Emily. And Zhongjun also asks, what statistical methods did you use to identify common groups of care movements?
So I wanted to do the technical stuff out, but for those who love the technical stuff as much as me, we use latent class analysis using M+, and we specifically use a 3-step method which encompasses the care history, kind of groups at the same time as the outcome and the confounders to create a well-adjusted analysis, which kind of goes beyond previous techniques which weren't able to do that. In terms of the mediation analysis, we used, so the mediation analysis is our risk and protective factors analysis. We used John Heron's and Gemma Hamilton's paper looking at latent class analysis and mediation, which again, kind of, hopefully if you search their names, you'll see them if you're interested, but I can also put it on the drive easy.
That's great, Emily. Thank you. Yeah, obviously we have a mixed audience, don't we? And you you didn't talk about statistical methods because the ExChange network is primarily designed for practitioners and managers in social care who you wouldn't expect to necessarily be statisticians, but it's also fine that we've got a mixed audience and some people do, as you say, like to know that stuff. So moving on, Yung Chao Jing also says, many thanks for a wonderful presentation. And could you please elaborate a bit more on the reasons behind a potential under-identification of mental health conditions? Are there diagnosis data from GP?
Yeah, exactly. So I can. These are all kind of theoretical reasons. It's not something that's been explicitly explored. So we use existing codes that other people have used for young people for their mental health problems. So it includes diagnoses, it also includes symptoms, and includes treatment of all different types. So it can be anxiety, depression, many different types of kind of common mental health problems. And we're not entirely sure whether it's that children kind of don't initially get picked up with mental health problems in that kind of small period. So we're only looking between just secondary school, so age 11 to age 16. It may be that kind of they're not picked up as much with those specific codes that we use, and maybe so the codes we use for kind of the codes we use now, but they may not be the codes that were used prior, so 2000 all the way to 2018. So it could just be a differences in how things are coded now compared to then, but this definitely needs kind of more research. But the most up-to-date codes, so I think, were 2018, I think. So again, that's kind of towards the end of our research, so it may just be a coding thing.
Thank you.
I wish I had the answer for that.
There's quite a few more comments in the chat. Just to warn people, I'll do my best to get through them all, but if it's possible that some questions might fall off the end and we don't want to go on beyond, we won't be able to go on beyond 2 o'clock. So Alison, I'm not sure which of our two Alisons it is. Anna Allison asks, as children become older, there's more likelihood that they'll be placed in residential homes. So did you have any insight into the gap in attainment for this cohort?
No, so we did a lot of work on what were the most common placements. Obviously, the analysis can only handle so many different types of care or entry of care, age of care. So we had to choose the most common placements and the ones the young people also felt were the kind of the most important ones. So things like mother and baby units, children's homes, residential care, we didn't use. Mother and baby units kind of only had quite a small percentage in the beginning. And then residential care and children's homes came after our care histories. So if we were looking at care histories in the teenage years, so or pre-adolescent years, age 11 to 16, we would definitely include residential and children's homes. But because they weren't really applicable to children that we were looking at for care histories before age 10, we didn't use them. So I don't have any answers on that, but I'd love to also do that too.
Another study.
Yeah.
I suspect this next question is also a different study. Are you able to say anything about the gap in attainment between care experienced children and children who receive support safeguarding from statutory agencies? I guess that is children who are not in care, but children in need living at home. I guess the answer.
I mean, our recent paper will kind of cover a little bit of that. So Dr. Sarah Long's ESRC study actually looked at the differences in educational outcomes for children in care versus those on the protection register, and also then kind of just care experience, so looked after all term. We did see that children, I want to say that children on the protection register, I believe, were 4 times more likely to not achieve compared to 1.5 times those who looked after. So there were big disparities, and those who are receiving care and support seem to be at greater risk for not attaining care education outcomes or GCSEs compared to those who had been looked after or had kind of higher intervention. So that information is out there.
I'll post a link to that paper.
Yeah,
It's an open access paper. I'll post a link to that in the chat. Thanks, Emily. That's helpful. Janet Ustendorp asks, do the statistics cover both mainstream and special school data?
Yes, so I believe so. When we made our education cohort, we just used all of the education data available for those children. So yes.
Okay.
We didn't filter on school type.
I hope I haven't missed anything. Richard Lloyd asks, I'm interested in the professional support addressing the points raised. Are they charities or LEAs? The professional support? I'm not quite sure. Do you want to ask that question, Richard? But
Hi, yeah. What I'm interested in is what support mechanisms are there? Are there charities supporting the young people, or are the schools providing this support? Because you've highlighted these issues, and these issues are there, they're common. So I wanted to know who's addressing these. Are the schools taking it on, or is there an assessment made by the local authority, and then they get the support, because there's a gap then, obviously.
Yeah. So my impression when I worked with teachers in terms of public patient involvement, they told me that they would largely work with social care kind of associates or social workers in a kind of cross-sector way to support these children. But it seems like decisions were made kind of on an individual basis. But that was kind of my work with those teachers in my general reading. I don't know, Jonathan, if you know any more about that, but it seems to be quite individually led.
Yeah. That seems, because I work for Voices from Ken. This is something I'm a project I'm working on, trying to really address the issues of trying to really support care experienced people to go to GCSE level, and trying to give that extra bit of additional support. And schools don't seem to be joined up. You have to go through the local authority, and then the school would decide if they have it. Within 1 or 2 schools, and they throw in support funding for us to maintain these supports. And I just feel that there's not enough being done, so we say, outside school hours, the extracurricular, the cookery clubs I've got, or we provide homework support, and obviously the social aspect of it as well. This brings on the young person, which if I could tell you a story, there was one young person, he didn't go to school unless his support worker came. There was support provided. We did a bit of work with him, and now he's in school every day. He loves school, and I think it was the social activities that helped him. So I was just interested in if you encountered any of these groups.
Yeah, I mean, they would have been included in the sense of the analysis, but I wouldn't have been able to look at the kind of specifics of what support they received. And I agree with you that there likely does need to be, there could well be a process that I'm not aware of, but it does seem to be quite local authority, quite school specific and how that's handled. And I think you make an important point.
Yeah, I think that's
Thank
right.
you. Thank you.
Thanks, Richard. I'll move on to one more question from, actually, a couple more questions from Annabelle Lloyd. Did you come across any studies that addressed what works in combating the impact of BLA for educational development? I'm sorry, I don't know what BLA.
I don't know either, and I was really worried then. It makes me feel better when someone else doesn't know, because it's not just me.
Annabelle, are you able to tell us?
Becoming looked after. Okay.
Becoming looked after. Ah, okay.
Addressed what works. So I haven't actually seen that many. Like, it'd be really nice, I guess, to see a case study of schools that do manage to support children to reach their potential, who are looked after. I haven't came across any case studies to my knowledge, apart from the one study that looked at what happens for children who are kind of disadvantaged, and when care experienced young people go to disadvantaged schools that specifically focus on lifting those children up, they do perform better. But that's the only study I've seen, which I did talk about in my slides. But that's the only school I've seen. Sorry, the only study I've seen.
I will see what I can dig out in terms of recent evidence review. Send something out in the email, Annabelle, with the slides and recording. See if I can follow that up with something useful. And the second question is, did young people have any suggestions about what we can all do to recognise the amazing skills, qualities and achievements of care experienced children and thereby tackle the negative narrative? So this would be from the consultations with CASCADE Research, etc. Yes. Yeah,
definitely. So they talked a lot about kind of the positivity, the focusing on the positive thing that school brings. So they talked a lot about not being like the person that's like, obviously in their personal lives, as soon as the children, that's the child that's always in care, the care experienced child. But actually school brought that normality to them, offered them specific types of support. And yeah, they talked a lot about kind of the sense of belonging, all of those aspects that school really offered just to kind of normalize life. So I think it would be really nice to do a piece on kind of the positive aspects of school, rather than kind of the risks. But they did talk about those aspects being important. And obviously, if anyone's interested in that research, please do it.
Thanks, Emily. And just a comment then from Sarah Atkinson from Social Care Wales, it seems that they're planning research roadshows around transition and safeguarding for next year. So she's saying she'll share your findings. And also with the evidence community, which is kind of an online community, Social Care Wales run. So
of course. And if you need me to disseminate or anything like that, I can come along.
Your summary out there, yeah. And you were going to post a link to it in the chat?
Yeah, I think I have. I've posted a Swansea University shared drive point, but essentially it's a folder that holds the files. But then the report will be available bilingually on our Centre for Research and Practice in Swansea University as well. So if you type in Centre to Research and Practice, Swansea University, it should come up with lots, and not just my report, but lots of our research that we do. So yeah,
can I ask a quick one? I think that that's all the questions in the chat gone now. I just wanted to ask, so you said at the very end, it wasn't causal. So when you talk about what works, I guess needs to be put in a bracketed by the because so something like the impact of, is there a chicken and egg about the suspension impact, for example?
Yeah.
That maybe some of the children who might anyway be kind of less amenable to their school experience, a bit more anti-school or something, would already be less likely to achieve, and then they get suspended because of their behavior, but it's not necessarily a cause. There could be, but it's not. We don't know it's a cause.
Yeah, this is what I think, and I think because that group who came in early and then returned home, that all have the kind of poorer experiences of school, and all of them are coming through. So there's something to say, I think, about not necessarily perspectives of school in a stigmatizing individual blame way, but how school is experienced specifically for that group. And there's something going on there for that group, because they really do struggle with school in lots of different ways. Yeah. And it's obviously not just, like you said, suspension exclusion. It's probably kind of a lot more nuanced than that.
The other thing I noticed when you were talking about the summary of the risk factors were free school meals and suspension. Obviously, they're very different kinds of things, aren't they? Because we might want to avoid free school moves and suspension, but we don't want to avoid giving free school meals. So you're not suggesting we shouldn't give children free school meals.
Absolutely not. But yeah, just an awareness that deprivation is clearly playing a role.
Yeah.
When it comes to educational attainment, which is obviously, we just use free school meals as a proxy really of individual kind of financial, I suppose, being under that kind of poverty line where you would be eligible, because we don't really have anything else yet.
Yes, Annabelle, who's the head of Children's Services on the Connecticut, has just put a note there that their virtual school would be very interested in future discussions about positive results, and she can share some information about what they're doing. So there might be, useful dialogue there.
Yeah, absolutely.
We'll try and follow up with some additional information about what's been found to be helpful. But I think on that note, we better say goodbye because the hour is up. There's the little impact questionnaire. If people could very quickly fill that in, just a couple of questions. Thanks ever so much to Emily. Emily is a really very quantitatively talented young researcher, and it's fantastic to see her working in social care. We want more people like Emily working on social care topics. Very clear presentation, Emily. Thank you for that. And thanks to everybody for coming along and asking some interesting questions. Look out for the next ExChange webinar.